Dangers of overeating during pregnancy. I know some pregnancy comes with cravings, which is caused by the elevation of estrogen and progesterone hormones, which makes some pregnant women to overeat. No one is blaming you for it because of course it is not your making. But irrespective of the fact that it is not your making, it can also be controlled. If not, you'll be putting your life and that of your baby at great risk. Let's look at 5 dangers that overeating will do to you during pregnancy. Number 1, when you overeat during pregnancy, you are bound to gain so much weight. And when you gain excessive weight while pregnant, it will make you to be having back pains, joint pains, and leg pains. Number 2, overeating during pregnancy exposes you to gestational diabetes. Gestational diabetes is a kind of diabetes that happens to pregnant women. At that point, their sugar level can be increased due to pregnancy. Sometimes it comes natural, while sometimes it may be as a result of overeating during pregnancy. Number 3, consuming so much food during pregnancy can increase your baby's size. And when your baby's size or weight is big, it increases the risk of you going through a cesarean section. But if you insist on giving birth through the vagina, you may have vaginal tears because the size of the baby is bigger than your vagina. Which brings me to number 4. Like I mentioned earlier, if a pregnant woman overeats, the size of the baby will be increased. Now, while the baby will be struggling to come out of the mother's vagina, the baby may injure his or her shoulder and also injure the mother's birth canal because of its size. Large babies are also prone to develop respiratory distress, danger of obesity, and a heart disease after birth. And lastly, number 5, overeating during pregnancy can cause preeclampsia. Preeclampsia can result to kidney disease or high blood pressure in pregnant women. It often happens as early as 20 weeks during pregnancy, that is the 2nd trimester. When this condition is intense, it can give rise to premature delivery. So you see, overeating during pregnancy is not doing you or your baby any good. That is why I mentioned earlier that it can be controlled. Now the question is, how can you control overeating when pregnant? Number 1, engage in light exercise like walking. By doing so, it will help you to regulate your appetite. Number 2, always be hydrated. Number 3, stick to a healthy diet and stay away from junks. Number 4, if you know you eat frequently, endeavor to eat them in small quantity. And number 5, if you're overeating during pregnancy, please consult a healthcare practitioner. That is, if you have tried everything possible to control your appetite, all to no avail, please speak to a doctor. Because if you continue with the way you're having the urge, you may be putting your life and that of your unborn child at risk.